Hello, welcome to Medicare 101, where we'll explain the basics you'll need to know about Medicare to confidently choose coverage for yourself or a loved one. Medicare is complex and has many moving parts. That's why we want to give you the knowledge to understand your options so you receive optimal coverage for your needs. Today, we'll go over how Medicare works, what your Medicare coverage choices are, when you can sign up for Medicare, what you should consider when choosing or changing your plan, and prescription drug coverage. Keep in mind that if you decide to work with an insurance agent, the agent represents you, the Medicare recipient, not the insurers. They receive extensive training and have a variety of plan options available. This allows them to tailor a Medicare plan that fits within your budget and your healthcare needs. If you decide to work with an independent insurance agent, you can depend on them to have up-to-date Medicare information and have access to multiple carriers, allowing you to make the best possible choices. Let's get started. Chapter 1, Medicare 101. Medicare is a federal health insurance program that started in 1965 for people 65 or older or people with a qualifying permanent disability. Your Medicare card, the white, red, and blue card, will have two parts, Part A and Part B, and you are eligible for premium-free Part A if you or your spouse worked and paid Medicare taxes for at least 10 years, as well as being a U.S. citizen or legal resident. Now let's talk about all the four Medicare parts, Part A, Part B, Part C, Part D. First, Medicare Part A is your hospital insurance. It covers inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. If you or your loved one has been working and paying taxes for at least 10 years, there is no monthly premium for Part A. If you have not, there will be a premium. Other costs may include a deductible, copays, and coinsurance. Medicare Part B helps cover medical care outside of a hospital, like services from doctors and other healthcare providers, outpatient care, home health care, medical equipment, and some preventive services. Part B does have a premium as well as other costs, like a deductible, copays, and coinsurance. Medicare Part C is also known as Medicare Advantage. It started in 1997. Since then, Medicare enrollees have had the option of opting for Medicare Advantage instead of Original Medicare through private insurance companies. Medicare Advantage plans often incorporate additional benefits, including Part D coverage with most plans and extras such as dental and vision, as well as additional supplemental benefits such as transportation, over-the-counter allowance, hearing exams and aids, and more. Lastly, Medicare Part D is the prescription drug coverage part of Medicare. Part D helps cover the cost of prescription drugs and is administered by Medicare-approved private insurance companies. Having Part D as part of your plan may help lower your prescription drug costs and help protect against higher costs in the future. We'll explain more about these plans later. Chapter 2, Picking a Medicare Plan. So, what are your Medicare coverage choices? There are two main ways to get your Medicare coverage, Original Medicare or Medicare Advantage. Here are steps you can take to decide how you want to get your coverage. Step 1 is deciding if you want to get your coverage through Original Medicare or a Medicare Advantage plan. So, as a recap, Original Medicare is made up of two parts, Part A and Part B. It comes with deductibles. Once your deductible is met for your medical services, Medicare will cover 80% of cost. The remaining 20%, you are responsible. Many who have Original Medicare coverage choose to purchase Medicare Supplemental Medigap policy to help with these costs, or a Medicare Advantage Part C, which have HMO and PPO plan options. The choice is yours. So just to recap, Medicare Advantage is also known as Part C, which combines what Original Medicare Part A, Part B, and Part D, as well as extra benefits like vision, dental, hearing, and more, all in one plan. Medicare Advantage plans are administered by private companies and was created because in many cases, original Medicare plans do not cover all the services Americans need. Original Medicare hasn't changed much since 1965, and people are living longer and have different health needs than in the past. Remember, HMOs work with a network of providers and services. You have your primary doctor, and if you need to see a specialist, you'll need a referral in most cases. Or a PPO, where you also work within a network, but have the option to go outside the network, but usually at higher cost, and in most cases, you don't need a referral to see a specialist. Or Medicare Supplemental Medigap policy. The choice is yours. There are also a few more types of Medicare Advantage plans. These are special needs plans, which are designed to meet the unique needs of people with certain qualifying conditions. If you have a chronic health condition, have both Medicare and Medicaid, or live in a long-term healthcare facility, you may be eligible for a type of special needs plan. Step 2. Decide if you need to add drug coverage. Remember, most Medicare Advantage plans cover prescription drugs already. If you choose a Medicare Supplemental Medigap policy, you may have to add drug coverage if not already included. Choose the option that best fits your healthcare needs, be it Medicare Advantage Plan Part C or a Medicare Supplemental Medigap policy. Now let's go over some rules that allow to go from Medicare Advantage Plan to Medigap, or from a Medigap, a Medicare Advantage Plan, back to a Medigap. If you chose an MAPD when you first became Medicare eligible and you are within the 12 months of the enrollment, you can qualify for a Medigap guaranteed approval, no underwriting questions. Or, on the other hand, you've always had a Medigap policy and never a Medicare Advantage plan, and want to explore your Medicare Advantage plan options due to policy being age-driven, meaning cost increase or any other reason, you can safely try a Medicare Advantage plan on a trial basis, and within the first 12 months, you can go back to the previous Medigap policy. Guaranteed approval, no underwriting questions. You have choices. Remember, in both scenarios, you only have one time to exercise that option. Chapter 3, Enrollment. Now that you've decided what coverage you need to know when you can sign up. You can sign up for Part A, Part B, or Part D during what is called the Initial Enrollment Period. The Initial Enrollment Period is a 7-month period beginning 3 months before the month you turn 65 and ending 3 months after the month you turn 65. If you sign up during the first 3 months of your initial enrollment period, in most cases, your coverage starts the first day of your birthday month. If you enroll in the month you turn 65 or during the last 3 months of your initial enrollment period, the start date for your Medicare coverage will be later. If you didn't sign up for Part A, Part B, or Part D when you were first eligible, you can still sign up between January 1st and March 31st each year, but you may be penalized. This is called the General Enrollment Period. When you sign up during the General Enrollment Period, your coverage will begin July 1st of that year. You may have to pay a higher Part A or Part B premium for late enrollment. If you are currently working and have creditable insurance through your employer, or you are covered through your spouse's employer, you can sign up for Part A or Part B later during SEP, Special Enrollment Period. A special enrollment period includes any time you're still covered by the group health plan, or during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first. Remember that COBRA coverage and retiree health plans aren't considered coverage based on current employment. You're not eligible for a special enrollment period when that coverage ends. To avoid paying a higher premium, make sure you sign up for Medicare when you're first eligible. Medicare's annual election period, or AEP, takes place between October 15th and December 7th. During the annual election period, anyone can join, switch, or drop a Medicare plan. You can switch from an original Medicare to a Medicare Advantage plan, switch from one Medicare Advantage plan to another, switch from one Medicare prescription drug plan to another, and join, switch, or drop a Medicare Medical Savings Account plan. The change will take effect on January 1st as long as the plan gets your request by December 7th. You generally must stay enrolled for the calendar year until the next AEP. However, in certain situations, you may be able to join, switch, or drop Medicare plans at other times. That's called a special enrollment period. These special situations include if you move out of your plan's service area, lose other creditable prescription drug coverage, live in an institution like a nursing home, have Medicaid, or qualify for extra help, or meet certain health chronic conditions. Chapter 4. Things to consider when picking a plan. Factors you should consider when choosing or changing your plan are coverage, cost, doctor, hospital preference, prescription drugs, quality of care, convenience, and travel. Questions you can ask yourself or your agent when reviewing your plan options are: does the plan cover the services you need? Do you have or are you eligible for other types of health or prescription drug coverage, like from an employer or union? If you do, talk to your benefits administrator or insurer before making any changes to your coverage. When choosing a plan, consider how much your premiums, deductibles, and other costs will be. How much do you pay for services like hospital stays or doctor visits? Is there a yearly limit on what you pay out of pocket? Do your doctors and other healthcare providers accept the coverage? Are the doctors you want to see accepting new patients? Do you have to choose your hospital and healthcare providers from a network? Do you need to get referrals? Think about your prescription drug needs. Do you need to join a Medicare drug plan? Are your drugs covered under the plan's formulary? Are there any coverage rules that apply to your prescriptions? Has my prescription been re-tiered for the following year? Don't forget about the quality of care. Are you satisfied with your medical care? If not, that's a good reason to change plans. Medicare has information to help you compare how well plans and providers work to give you the best care possible. Which pharmacies can you use? Is the pharmacy you use in the plan's network? If it's in the network and your plan has preferred pharmacies, is your pharmacy preferred? You may pay more at non-preferred pharmacies. Can you get your prescriptions by mail? Lastly, will you have coverage in another state or outside the U.S.? These are all important questions to ask when choosing the plan that's best for you. Chapter 5, Part D, Prescription Drug Coverage. Now let's talk about how Medicare prescription drug coverage, or Part D, works. Medicare offers prescription drug coverage to everyone with Medicare. Even if you don't take many prescriptions now, you should consider joining a Medicare drug plan. To get Medicare prescription drug coverage, you must enroll in a Medicare Advantage plan, Part C, or standalone prescription drug plan, Part D, or other creditable coverage approved by Medicare. Each plan can vary in cost and specific drugs covered. There are two ways to get Medicare prescription drug coverage. The first one is called Prescription Drug Plan Part D. These standalone plans, sometimes called PDPs, add drug coverage to original Medicare and some other Medicare plans. The second way is through Medicare Advantage plans like an HMO or PPO, or other Medicare health plans that offer Medicare prescription drug coverage. You get all your Part A, Part B, and prescription drug coverage Part D through these plans. Medicare Advantage plans with prescription drug coverage are also called MAPDs. You must have Part A and Part B to join a Medicare Advantage plan. Chapter 6, Getting Help. To summarize, we went over how Medicare works, what your Medicare coverage choices are, when you can sign up for Medicare, what you should consider when choosing or changing your plan, and prescription drug coverage. If you are turning 65 soon or the annual enrollment period is approaching and you want to shop plans, you can get help calling this number or visiting the Medicare website. Call 1-800-MEDICARE or go to medicare.gov. Whatever your situation may be, we advise that you shop around for Medicare plans because plans and your health needs change year to year. Visit health plan providers' websites to compare plans in your area. Or another option is to get help from an independent licensed agent. Independent licensed agents don't work for a health plan. They work for you. Their help is free, and costs are not higher when enrolling directly with the health plans. Agents have the flexibility to provide multiple options and make unbiased recommendations, making them a valuable resource for questions, help, and enrollment. They also want to support you after the enrollment period, so you can ask them questions about claims, coverage, or authorizations. And of course, they will help you shop and compare plans each year. You deserve to understand your options and receive the maximum Medicare or prescription drug benefits available. We hope this Medicare 101 resource was helpful to you. We wish you the best as you navigate this stage of your health journey. Happy shopping!